As a vote on the Indigenous voice to Parliament looms, a peak medical body has confirmed it will support the Yes campaign. The Royal Australian College of General Practitioners has mirrored comments from Indigenous Australians Minister Linda Burney, declaring a voice will improve health outcomes for First Nations people and address inequity within the health system. Joining me for more on this is the RACGP President, Dr Nicole Higgins. Thanks for your time. So you would have seen, I guess, and both certainly on the front line, but also as your role as President, how stark the outcomes are between First Australians and the rest of the nation on health outcomes. Why do you think it's so, first of all?
So it's really important that we have a voice in Parliament. What this will do is have Aboriginal and Torres Strait Islander peoples at the table on health policy. And this will, as you said, address health outcomes and also inequities. We saw the impact of this during COVID when Aboriginal and Torres Strait Islanders really managed their communities, got prevention, got vaccination and managed COVID so well. We need to now enable that to be a national voice.
So when it comes to having that voice, what is happening at the moment in terms of ideas, policies, whatever it might be, that would help, that's for some reason not being taken up by the bureaucracy?
So what we know from evidence from overseas, by enshrining this within the Constitution, it actually has better outcomes for healthcare for First Nations people. And that's been, research has shown that in Norway and New Zealand and Canada. And by having a seat at the table, that voice is heard. And this is around health. But health in Aboriginal culture isn't just about the absence of disease. It is also about the social, emotional and cultural wellbeing of the whole community. And that is why we're supporting the voice.
Have you had conversations with such communities and elders and they've said, we'd like to try, any given example, but we cannot get heard on this and that's why we need a voice? What examples can you give?
Yeah, and as I said, I used COVID as an example. And this morning I was with Dr Karen Nichols, who heads up the National Faculty for Aboriginal and Torres Strait Islander Health for the College of GPs. Karen trained here as a hospital doctor and also as an intern and has been meeting with community and family. And this is a way of making sure that those voices are actually heard and making sure that they are always consulted around decisions on health policy and how that impacts their communities.
What about the regional and remote factor? We obviously have a high proportion of First Australians in regional and remote Australia. Those areas also generally have worse health outcomes. So is closing the gap around making sure First Australians have the same outcomes of anyone else compared to where they live? I mean, we'd like to close the regional and remote gap as well, but while that gap exists, there will be a gap generally?
Yeah, look, I'm a regional GP and closing that gap is, it's just such a huge challenge. And the health inequity that we have, as you said, between Aboriginal and non-Aboriginal Australians, between rural and remote and urban, making sure that, and there is a crossover sometimes on those issues, but particularly for our First Nations people, we need to make sure that they are consulted each and every time and that they are at the table when those decisions around policy is being made.